Well, I think technology is a part of nursing every day now. But with all the innovations, it just gets better and better. Well, if you think about it, when babies are born, there's a nurse. And all through life, surgical procedures, or you have to go to the emergency room, there's a nurse. And often, as you're dying, there's a nurse caring for you. And at your death, there's a nurse. So nurses are very important to all of us all through our lives. So everything they do to provide care is important. Any new ideas to make their care better is important and has to be applauded. Nursing, it's not easy to be a nurse. And we need to honor and acknowledge and applaud nurses. The important thing to remember about nursing is that it's an art and a science. And the science and the care delivery is so important. But what the patient remembers is the art and how kind and compassionate the nurse was.
I think a nurse has to lead with her heart, connect with the patient she's with, but apply the highest level of skill, education, and knowledge to help support them through their healing process, and do it reliably, day in and day out.
And the nurse today has to, say for instance, a hospital nurse, hospital-based nurse, has to remember that it's not just the patient in the bed, it's the family around the patient. That's a very big part of that patient. So you're really just not providing care for the patient, but for the patient's family as well, if you're a good nurse. So maybe with some of these innovations and changes and improvement in the delivery, a nurse will have time to be a nurse, which is maybe why he or she wanted to become a nurse to begin with.